So our next speaker is our own alumnus, MariaCrowe, who's going to be talking to us to focus on key manufacturing levers to mitigate against supply chain risk. Maria joined Lilly in 1982 and since 2012 led the company's global manufacturing network of 14 sites over 4 continents. So we're delighted to have her here as a speaker. Maria, the floor is yours.
First of all, let me thank the folks in Krannert for the invitation and the Supply Chain Institute to be here today. It's a topic I have a lot of passion about, so I'm thrilled to have the chance to talk. And I'd also like to recognize the former speakers because I think everyone's presentation has given a very different perspective on supply chain. And you probably have a feel for by now about how many different aspects of supply chain there are. And I hope that I can present a few others. First of all, who from Lilly is here? I heard a question. Okay, a few folks from Lilly here today. Great, welcome. How many students here are undergrad? And graduate students? Okay, a mix. How many supply chain graduates? Okay, good. You've chosen a great place to start. Okay, so as Dr. Iyer said, I graduated from Krannert in 1982, and I will put a plug in here for the placement office because I got my job at Lilly through the Krannert placement. It was one of my first interviews in the fall, and although I interviewed many other places, I ended up accepting the job at Eli Lilly and Company and started to work 2 weeks after I graduated from Krannert with my undergraduate degree. And after 35 years of a great career at Lilly, I did retire at the end of last year. So I'm now moving into the next zone of my life and trying to figure out what that's going to be. So I'll try to share with you some of my own perspectives that I learned through time. I'm going to begin by telling you a little bit about the company. For some of you who may not know who Eli Lilly and Company is. And then I really want to talk about 3 key aspects of managing risk around supply chain. One is the product design. The second is the supply chain design that goes along with the product design. And the third is really then the fulfillment of that supply chain. I hope to relate to you some aspects from each of these 3 key areas of supply chain. So first of all, Eli Lilly and Company is an innovative-based pharmaceutical company headquartered in Indianapolis, Indiana. The revenue last year, $23 billion. We have around 42,000 employees globally. Roughly half of those are in the U.S., roughly half outside the U.S. And manufacturing, including quality, supply chain, and all the accompanying functions, are about 9,000. So we make up about 20% of the overall company in terms of ensuring that the product is supplied. Now, if you think about pharmaceuticals, we've heard about different industries today, and every industry is important. But I think what we do is critically important because one of our responsibilities in supply chain is to ensure that you or your parent or your grandparent or your child who is the patient gets the right medicine at the right time every single time. And therefore, we in the manufacturing component who operate the supply chain have the responsibility of being the last people to touch the product before you take it as a patient. We take that responsibility very seriously because when you're sick or a loved one is sick with diabetes or cancer, the last thing you want to do is question whether or not the medicine that you're about to take is okay or not. So that's a very important responsibility that we have in supply chain and adds a life-saving component to it that some of the other things we've heard about this morning don't have. Capital investment's about $1 billion a year. Most of that is in manufacturing. Probably 3/4 of it is normally spent in manufacturing on facilities, and the remainder of that capital is spent in other parts of the company. I might also mention that Lilly is a very old company, over 140 years old. One of the few U.S. founded American companies that have lasted for that long without a major merger or being acquired or doing another major acquisition. So it's a history that we are very, very proud of. Let me talk first a little bit about product design. And I think this is probably true no matter what industry you reside in. But for us, it's critically important because it is the design of the product that determines, in essence, the supply chain for that product. So is it a chemical Is a product made through chemical synthesis? Is it a biologic product? Does it have a device which is offered for patient convenience? What dose is the product? Dose is extremely important to us. And what I want to do is just give you some examples as I go along so that you can get a feel for what this means. So take dosage. If you need an antibiotic, it's a big flu season, and when we made antibiotics, it was highly influenced by the flu. We were tracking the amount of flu in the US and by state continuously throughout the flu season. We no longer make antibiotics, but assume that you did get the flu and you got an antibiotic. You probably were taking potentially something like 500 milligrams 4 times a day. So you'd be taking 2,000 milligrams of that product a day. And let's say it's a 10-day course of therapy, then you would need 20,000 units of that product over the course of that therapy. As we move along in time then, other products came into the fore and we developed higher potent compounds. So if you take Prozac, and that's pretty much a household name at this point, it was a product for the treatment of diabetes, changed the face of diabetes treatment around the world. It's a 20 milligram once a day dose. So now imagine instead of 2,000 milligrams a day, you're taking 20 milligrams a day. That completely changes the amount of capacity you need to make that product on a multi-fold basis. So things like dosage are critically important to us. They also then play into product costs because obviously if you have to build lots of facility, take insulin. When I was in Puerto Rico on assignment, we built an insulin facility. We spent $1 billion building that one manufacturing facility to make insulin. We have 2 of those facilities to support diabetes around the world. So it is completely dependent on how the product is developed. In our case, that development is also tied to the technology. You can't just make every product as an oral dosage form. Insulin is an injectable form. That's a different way that you make the product through a biological process. It often goes into a device that automatically changes your overall supply chain and your cost of product. So you don't always have a choice, but we would say that 80% of the product cost and 80% of the supply chain is locked down when that product goes through product development. After that, you can tweak it, you can improve it, but you're never going to fundamentally change that overall product, most likely. So things like that you do within the development phase of a product can have a dramatic impact. And someone mentioned earlier, the more common the technology platform, therefore the more shared the capacity can be, that has an impact as well. So those are some examples of things that we thought about as we were designing the product. Because of that, manufacturing worked with our development organization 5 to 7 years ahead of a product launch. So it takes a long time to build manufacturing capacity in the pharma industry and in many other industries, and you have to be involved in the supply chain process well before you're thinking about actually supplying that product. So the second thing then that we think about that goes hand in hand with that is the supply chain design. You know, there are several different key factors impacting this. Are we going to make that product inside, or are we going to buy the product? How much of the supply chain are we going to purchase? How much of it do we want to make inside? We, for the most part, made the majority of our products inside. Not every step of the supply chain, but at least the last few steps of the supply chain. That goes along with the company history. It also goes along with protecting the patient from a security of supply perspective. And, you know, we make those decisions, you know, on many, many different factors. So even though we would like to make most of our products inside, let's say it's a new product. We launched a product a couple of years ago. The product name is Trulicity. It's for diabetes. And we weren't exactly sure what the demand for that product was going to be. Some aspects of it used some existing technologies and some used new technologies. So we leveraged by building some internal capacity and acquiring through a third party some external capacity in order to protect that supply chain. It turns out that the folks who made that decision in our supply chain and manufacturing organizations made a very good decision because that product has been extremely successful. Its growth rate in the market has been much faster than we anticipated, and because we had both internal and external aspects to leverage to the maximum of the capacity, we've been able to maintain what we needed to supply that product. That is a life-saving diabetes product. It was critical to us to be able to do that. So that's an example of make versus buy. In any kind of an industry, depending on the country regulations, we supply product in about 120 countries around the world. Some of those countries demand a local presence. So if you do not make product by some type of a value add within that market, you can't sell the product in that market. And when you're providing life-saving medicines, you want to be able to supply those to every single country. So sometimes we have some local manufacturing, which is some that we do ourselves, like Brazil is an example of that, or others where we might use a local third party, say Saudi Arabia, to help us with local presence for those markets. So there's lots of factors that go into the overall design of the supply chain. One of the things that we really try to focus on are common technology platforms. This really allows us to leverage the capacity because it's quite expensive to build pharma capacity for as many products as possible. So let me give you an example of one of the things that happened a few years ago. We wanted to launch biologics. The only biologic products that we had in the company at that time were insulins. Insulins are very high volume biologic products. But we had in our development and research pipelines a number of products called monoclonal antibodies, which took a whole new set of technology in the biologic space. And this was brand new for us. We didn't actually know at that point if any of those products were going to make it through the overall pipeline. So what happened is a gentleman named Bill Heath, who works in our development organization, put the challenge out to his scientists that we would develop between the development and manufacturing organization what we call a train of equipment, a common set of equipment that every biologic in the pipeline could be made in. Now, most scientists do not like this. Scientists like to, it's an art form for them. They want to develop the process that they think is the most efficient, that works the best for their product. But Bill was able to convince the scientists, unless they could find another means, they had to find a way to develop the product using that equipment train. That has been extremely successful for us. Our biologic facilities can be utilized for so far with a few tweaks for every product in our pipeline. We have spent probably about $1 billion building monoclonal antibody capacity to date. And therefore, that strategy was extremely successful, and that pays off through the entire life of that. And remember, it's not just equipment sets in factories. It comes down to people. One of our philosophies is to employ people for a long-term career. If you're building different facilities for every product and then the product doesn't make it and you don't need that facility, all of a sudden you have a group of people that you don't need. And that is not a philosophy that we used in terms of running the company. So those are some examples within this area of supply chain design. Again, this starts very early for us in the product development life cycle, just to ensure that we have a good supply chain. Okay, let's talk a little bit about then the fulfillment process and providing product actually all the way out to the patient. There's a lot of factors that go into this for us. Someone said earlier, a part of it is how prepared you are for different scenarios. And there's been a lot of discussions about natural disasters today. We've had a few of our own that I can add some stories about. They're very interesting to me because you think they're things that are never going to happen because they're so rare. And yet when they do, if you're not prepared, you have a big issue. So we had Hurricane Maria in Puerto Rico last year. I did spend 5 years on the island. I love the island dearly. Had a great assignment there, so it was quite emotional to me that the hurricane carried my name. But the group there were very well prepared. We make insulin for people with diabetes in that facility. It is a life-saving drug, and therefore we carry quite a bit of that product in inventory, as you can imagine, so that we never run out. But we do other life-saving drugs and other drugs on the island as well. So we did have a lot of preparation. The group there, I think, were very well prepared. Their reaction to the hurricane was very, very fast. We had the plant up and running, or capable of running, within about 2 weeks after the storm. We had some minor damage to repair. We were lucky because we're located on a road that has a hospital down the street about a mile away, so the electricity came back within a 2-week period. We didn't actually fully restart operations at that point, but we did have capability to do that. And some of the things that we did in Puerto Rico just to prepare ourselves were that we have credit unions on site on most of our Lilly facilities. It used to be the Eli Lilly Credit Union. Now it's run by an external company. But in Puerto Rico, they also have a on-site credit union. And what happened when the storm hit in Puerto Rico is the entire island moved to a cash system. You couldn't use a credit card for anything. So if you wanted gas, if you found a grocery store open, any transaction you needed to do had to be done in cash. Well, ATM machines need electricity, so there weren't a lot of active ATM machines on the island. But there was a lot of planning. The guy who runs the credit union, it has a board as a former employee of the company, and they had $1 million of cash in the credit union ahead of the storm. And one of the first things they did was ensure that the backup generator was connected to the ATM machine, so any employee who could get to work could get cash to transact. And this goes along with the comments made earlier that there is nothing more critical in any of our businesses than the people. I don't care what facility you have, how much money you have, what products you have. If you don't have people who are capable and can get to work safely, and go home safely every day, you really don't have anything at the end of the day. So the safety of our employees in Puerto Rico was our number one. It was probably one of the most tenuous 2 weeks of my career because it took us 2 weeks to locate all the way down to the very last employee of about 1,000 employees there. And I had many sleepless nights because it was always one of my things that I wanted to leave the company without ever having someone who experienced death due to some kind of a work-related incident. So we did find everybody, and there are lots of other stories I could tell you about that. But I think the way you operate the supply chain is critically important, and it takes good planning, and it takes good execution. And there are many, many aspects of it that must be considered. So I think no matter where you work, if you ever have a chance to work in supply chain, I highly encourage you to do it. I'm a Krannert graduate in industrial management, computer science. And so I went to work in the company in IT. I'm not a manufacturing person by background. But about 2 years into my career, I had the chance to move to Virginia. At the time, Lilly owned Elizabeth Arden, the cosmetic company, which was really a very, very fun business to be a part of. And after 2 years in IT at that facility, I took a job as a master scheduler in supply chain, and it was one of the best assignments I ever had in my entire career, because you can see everything in a plant site from A to Z. And there aren't very many jobs in a manufacturing plant where you can see the whole spectrum of activity that happens in a plant. So any of you who are in supply chain or who are interested in being in supply chain, I highly encourage you to do that, or even take a cross assignment if you ever have a chance in your career to have a job in supply chain. So in closing, I just want to reiterate the 3 aspects that I tried to cover a little bit this morning. These are all levers. They're levers to reduce the risk in the supply chain. They're levers to improve the success of your supply chain. They're levers to ensure that the product, whatever your product is, gets to the customer at the end of the day, to allow the company to sell product. You can't sell it if you don't have it in inventory. If there's no product to ship, you can't make a sale. So there are many, many aspects of supply chain all the way that start from the very original design of the product, which leads to the process design, to the supply chain design, and sets you up for a successful execution of the supply chain. So thank you very much.